Hello everyone. So today we are going to learn about the anatomical snuff box. Okay. So basically what does that mean? So snuff box is something which was in the earlier times used for snorting or inhaling any kind of drugs. So here this is the picture of anatomical snuff box. This is the creation of a depression-like structure in the lower part of the thumb. So this represents or resembles a snuff box. So we name it as anatomical snuff box. Now we will focus on what are the main contents of the anatomical snuff box. So when it comes towards the artery, nerve, and vein, so the basically three things are the main contents of the snuff box, which is your radial artery, branch of radial nerve, not actually the radial nerve, but it's a branch of radial nerve. This is to be noted. And then we have cephalic vein. So if in the exam two options come as radial nerve and branch of radial nerve, so priority will be the branch of radial nerve. Although it is also the radial nerve, but then we'll have to choose the option on a priority basis. Then branch of radial nerve will be the correct answer. Now we'll come towards the borders of the snuff box. So borders basically include medial, lateral, proximal and floor. Okay, so for the medial border, snuff box has medially extensor pollicis longus. Okay, now the lateral border has extensor pollicis brevis and abductor pollicis longus. Now we'll talk about the proximal border, which is consisting of the stelloid process of the radius bone. Okay, radial bone. Now we have floor of the snuff box which has carpal bones, basically scaphoid and trapezium. Okay, so you have to remember these two names with the cellulose process name and these two obviously the tendons or whatever the medial and lateral borders. Okay, now we have the presentation of the artery and vein and nerve in the snuff box, which is basically you can see a triangular kind of depression which I have made it here. This is your thumb and this is the depression representing the snuff box. Okay, so the proximal part has the radial artery. In between the radial artery and the cephalic vein we have superior branch of the radial nerve, and in the last there's cephalic vein. So if we count on from the proximal part of the thumb, we can see that first we have radial artery, then we have superior branch of radial nerve, and then at the last we have cephalic vein. Okay, now we'll talk about the main contents we did just, and now we'll talk about the border. So this is the border representation, which you can see the floor is of scaphoid and trapezium. This is the basically the medial border, which is EPL, extensor pollicis longus. This is the proximal border, which is basically the stelloid process of radius, and this is the lateral border, which has extensor pollicis brevis and abductor pollicis longus. Thank you so much for watching. If you like the video, do share and subscribe to the channel.